In an Australian first, hundreds of WA stroke patients will be examined to find out how survivors can make a better recovery. Today, researchers were given a funding boost to help with their vital work.
Sally Atwater was left unable to talk after suffering a stroke last year. The 78-year-old is one of the lucky ones. After receiving immediate speech pathology treatment as part of a trial, she was able to communicate once again.
It was great and it did help.
Sally is part of 4,000 West Australians who suffer a stroke each year, but many don't recover as well as Sally. And Associate Professor Erin Godecke from Edith Cowan University plans to find out why.
We're going to be looking at hundreds of people coming through the doors, collecting a lot of information about them and finding out what factors make a better recovery.
The research has been made possible after the government announced it would spend $800,000 on 28 local research projects.
So this means that when your mum or dad comes to the hospital, they will have the opportunity to be involved in medical research or medical trials, which means that they'll get the very latest in treatment or the very newest medications.
But the elderly aren't the only ones at risk. In the past 4 years, stroke rates among children with obesity have skyrocketed. And those who don't have a successful recovery often experience high rates of depression.
Imagine waking up and not being able to talk. You can't text, you can't write, you can't read the newspaper, you can't go to the bank, you can't get online.
The research will get underway next year. Rebecca Munro, 10 Eyewitness News.